Celebrity McNeal. I'm a family nurse practitioner student at Albany State University. Nice to meet you.
Same here.
It's my understanding that you're here for a diabetic foot exam today.
Yes.
Great. May I have consent to begin?
You do have consent.
Thank you. I'm going to wash my hands and we'll get started. So how long have you been a diabetic?
2 years.
Okay. And are you getting your hemoglobin A1C lab performed?
Yes.
Okay. And are you aware of what that test for?
No.
Okay, so the hemoglobin A1C tests your blood glucose levels 3 months back, okay? So it's very important that you continue to get those tests. Also, we want to make sure that you get your diabetic foot exams done regularly, okay? Just so you know, diabetes can restrict blood flow to your lower limbs and your feet, okay? So we're going to go over some guidelines at the end of our visit, just some great things just to be mindful about as far as your foot care, okay? So first off, I'm going to go ahead and put my gloves on. And I'm going to do an inspection of your feet, okay? What I'm looking for is any missing limbs. I'm looking for any hair loss, okay? Just look here. I'm actually going to go ahead and lift this up. Looking for limbs, any hair loss, skin changes, any redness, okay? I'm looking for ulcers, okay? And I particularly want to make sure that I'm paying attention to the bottom of your heels. That's a bony prominence that is very prone to get an ulcer. Okay. Also, I'm going to go ahead and check the temperature of your legs. I'm making sure that they're equal. I don't feel any warmness or anything of that sort. Okay. Feel the same. Okay, I'm going to go ahead and check your capillary refills, okay? This is just making sure that we have proper circulation. Okay, very good. Very good. I'm going to look in between each toe. Okay, just make sure I don't see any calluses that are trying to form. Okay, very good. Okay, next I'm going to go ahead and check your pulses, okay? And I'm just making sure that they're equal on both sides, okay? I'm going to check your dorsal pes. Very good. And your posterior tibial. Very good. Okay, same here. Very good. Okay, at this point, would you please lie back for me? And I'm going to go ahead and just do a little neuro test, okay? I do have a monofilament, okay? And I'm going to use this just to touch the bottom of your feet, and you tell me when you can feel it, okay? Okay, you will just kind of flex your feet, okay? Let me know when you feel it. Just say yes or no.
Oh, yes.
Okay. You feel that?
Yes.
Okay, how about here?
Yes. Yes. Yes.
Okay, very good.
Yes. 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 Yes.
Okay, very good. Okay, next I'd like to know if you feel any pain at all, okay? You're going to feel a dull object and a sharp object, okay? Let me know which foot you feel it on, okay?
My right foot.
Okay.
Left.
Okay. Any pain at all?
No.
Okay, is that sharp or dull?
Feels dull.
Okay, which foot?
Right.
Okay, and how about now?
Right.
Okay, and how about now?
Left.
Okay, and sharp or dull?
Dull.
Okay, and left or right foot?
Left foot.
Okay, and how about now?
Right foot.
Very good. Okay. Next, I'm going to use what is called a tuning fork, okay? This is going to vibrate, and I actually want you to be able to feel what that feels like, okay? Okay, so I'm actually going to put this on one of your bony prominences here, and you let me know when you feel the vibration stop, okay?
Okay.
Okay, so here we go.
All right. Stop.
Okay.
Stop.
Very good. Okay, next I would like to go ahead and just check your reflexes, okay? So we're going to bend this foot here, okay? And I'm going to check your reflex here, okay? And if you feel a jerking sensation, that's okay, okay? Try it again. Okay, very good. Let's try this here. Okay, very good. Okay, at this point, I'm going to go ahead and have you to sit up for me. Okay, I'll put this down. And if you'd like to put these socks on quickly, I'm going to have you to walk across the room. This is going to assess your gait, okay? So I'm just making sure that everything is symmetrical, okay?
Okay.
In the meantime, I do have some guidelines that I'm going to go ahead and talk to you about, okay? We want to make sure that you're inspecting your feet daily. We want to make sure that you bathe your feet in lukewarm water, never hot water, okay? Also, be very gentle when you're bathing your feet, okay? You don't want to be too rough because that could cause some type of wounds, okay? Also, we want to make sure that you moisturize your feet, but remember not to moisturize in between your toes, okay? That could create a moist area that it could start a fungus to grow, okay? Also, if you happen to cut your nails, we don't recommend that you cut them yourself. You may go to a podiatrist and I could give you a referral for that if needed. But if you do decide to cut your toenails yourself, you want to be very careful not to cut yourself. Again, that can create a wound which could be hard for you to heal, okay? Also, I want to make sure you never ever treat your own corns or calluses. A podiatrist can assist with that as well. Always wear clean, dry socks. This is also a pair of diabetic socks. So that's very good for you to wear. Will help with circulation. Also, I did read in your chart that you are a smoker. So we want to make sure that we cease the smoking. I can also give you referral for smoking cessation, okay? Because smoking does restrict blood vessels and we don't want that, okay? That could initially lead to poor blood flow, which can ultimately lead to amputation. So we want to make sure we don't do that. Also, we want to make sure that you're keeping your blood sugars under control, as we want to make sure that you're checking your blood levels, your blood sugar levels daily. And last but not least, we want to make sure that you continue to get these foot exams, okay? Okay, so at this time, I'm going to go ahead and watch your gait. I'm going to help you down. Okay, and then you can just walk across the room slowly. Very good, and now walk back this way. Looking at your feet. Okay, very good. Okay, if you'll go ahead and have another seat up there. And last but not least, do you mind if I check the soles of your shoes?
Go ahead.
Okay, great. And I just want to make sure that they're even and okay, and they're good quality, great rubber soles. Okay, great. Well, thank you so much, Ms. Renika, for coming in for your diabetic foot exam. I look forward to seeing you again. Any questions for me at all?
No, I think I'll be all right.
Okay, well, thank you. Thank you. Have a great day.
Okay, thank you.
Thank you.
Bye.